deeply disturbing situations that we're in the medical profession. 80% of our medical costs and our focus is not on these acute infectious diseases or trauma, but in chronic diseases.
Renowned physician, Dr. Robert Lufkin.
In the United States, half adults are either diabetic or pre-diabetic. The problem is just treating diabetes with pills overlooks diabetes as a disease of carbohydrate toxicity. If people just refrain from eating carbohydrates, in most cases, they're able to reverse their type 2 diabetes. The problem is this message is not being communicated well. A hard-boiled egg is nature's Ozempic. If you eat 3 of those a day, you're probably not going to need Ozempic because your appetite's going to go down. Many people, and even many of my colleagues, are still not aware of this. They still, say, "Oh, avoid eggs for your heart," and that's just not true. Non-alcoholic fatty liver disease, this disease that didn't exist before 1980. This was a wake-up call for me because before I wrote this book, I wasn't aware of this either. But statins have an improvement in heart disease and decreasing heart attacks. The problem is,
hey there, welcome to the Happy Habit Podcast. If you're new, I'm Matthew. I'm right here every Monday and Thursday talking to really interesting experts on such important topics as health, well-being and self-improvement. So if that's your thing, you're in the right place. If you're already familiar with the podcast and would like to show your support and give us some thumbs up, you can like, subscribe, share with other people, tell other people about the work we're doing here on the podcast. The word of mouth is so important. You can also check us out on YouTube, become a subscriber there, as many have done in recent weeks. You can also join the conversation on YouTube by leaving a comment on any of the interviews and click that bell notification for future videos, which, as I said, come every Monday and Thursday. Today, I talk with renowned physician Dr. Robert Lufkin. He is the author of the new book, Lies I Taught in Medical School. Look, scientists and doctors are human, and with the best will in the world, mistakes are made. Plus, research is constantly evolving over time. So what was deemed to be correct medical advice yesterday isn't quite so correct today. My conversation with Dr. Lufkin covers a series of lies that have impacted how doctors treat chronic metabolic illnesses. We hear about the obesity lie and discuss what exactly is driving obesity worldwide. We also talk about the heart disease lie, that we've been told that fat is bad, the longevity lie that aging and wear and tear is inevitable, the Alzheimer's lie that it is not preventable. We discuss the lie that high blood pressure can only be treated with drugs. This is a really fun and eye-opening conversation. You will definitely learn a thing or two. I hope you enjoy. Well, Dr. Robert Lufkin, author of Lies I Taught in Medical School, welcome. Thank you so much for joining me today, and congratulations on the new book. And it's a terrific read. A real eye-opener, and I think it's many things, but very definitely I think it's a clarion call to people to realise that the medical field hasn't always been truthful with its patients.
Yeah, thank you, Matthew. You're very kind. I'm a fan of your program, and it's an honor to be on your show today. The title, Lies I Taught in Medical School, is intentionally provocative, I think, to get people's attention, and but I think it highlights some deeply disturbing situations that we're in the medical profession. And I guess I should say I'm not a conspiracy theorist or anything. I'm sort of the quintessential medical insider. I'm a medical school professor. I've spent my whole career teaching and practicing medicine at medical schools in the United States, and I write research, peer-reviewed research paper. I've written hundreds of them. My lab has received millions of dollars in funding from, the U.S. federal government, from drug companies, from device makers. So I'm kind of on the inside of the medical establishment, and what I write about in the book is critical of Western medicine. But I want to go on record in saying Western medicine has done amazing things for our health. In the 20th century, it revolutionized through public health and infectious disease. Western medicine is unequaled in the benefits it gave us. And even today, if I get hit by a car tomorrow and, I need a blood transfusion, I need a splenectomy, and I need, my bones set, I want Western medicine to take care of me. Lifestyle will have benefits, but in the acute life-saving situation, Western medicine, there's nothing like it. And I still believe that. The problem is, and what the book focuses on is, in the 21st century, 80% of our medical costs and our focus is not on these acute infectious diseases or trauma, but in sort of a new set of diseases that it was present before, but now they totally dominate the medical landscape. And these are so-called chronic diseases. And, they go all the way from obesity, diabetes, cancer, heart disease, Alzheimer's disease, even mental illness. And these diseases, when we try and apply the usual Western medicine approaches of pills and surgery, which was so effective, in the 20th century, for those, the conditions I mentioned, they don't really work for these chronic diseases. Now, they may save lives or even treat the symptoms, but the fascinating thing is the underlying drivers of these chronic diseases, which we talk about in the book, are basically very similar things. And the pills and the surgery aren't effective at the underlying causes of these diseases, and that's really the message of the book. And the great news is that we do have control of these underlying drivers, and these are things that we as patients can all influence in ourselves through our lifestyle and the choices we make.
Well, the book is brilliantly laid out in chapters, and each chapter is associated with a particular lie that we've been told by the medical field down through the years. As far as you're concerned, let's take on one lie. As far as you're concerned, what are the main causes of diabetes and heart disease today?
Heart disease is very important because for you, me, and most of our listeners, statistically, that is the number one killer, which we will all most likely die of, and it determines our longevity. So heart disease is right up there. Diabetes is also right up there because, one, it's a major driver of heart disease. And two, around the world, we're experiencing an epidemic of diabetes that has never been seen before in recorded history, even accounting for changes in population size and everything. In fact, in the United States, by some studies, over half adults are either diabetic or pre-diabetic. And this is continuing to rise. And it illustrates one thing is people say that, diabetes is just related to genetics, et cetera, et cetera. You either get it or you don't get it. Well, the fact that it is exploding in numbers indicates that our genetics don't change, but something else is changing, and it has to be our environment. The interesting thing about diabetes is that there are two types of diabetes. The major type 2 diabetes is basically is caused by the body's inability to process carbohydrates, and it's insulin is a hormone that allows us to process sugars and starches in our body. And when we consume too much sugar and carbohydrates, the insulin goes higher and higher, and our body becomes less sensitive to it. And this is called insulin resistance, and that is sort of the sine qua non of type 2 diabetes, is this insulin resistance. And the issue is modern medicine now addresses type 2 diabetes by giving more insulin, which the body may not be able to produce enough, so more and more insulin is given. And that can be life-saving. Like many surgeries and pills, they do treat the acute symptoms, and insulin will keep someone from dying of, too much blood sugar or hyperglycemia in the moment. The problem is there are a lot of long-term effects of diabetes that the insulin in many cases doesn't treat. What are those effects? Well, the number one cause of surgical amputations is diabetes. The number one cause of renal failure and renal dialysis is diabetes. The number one cause of retinal blindness is diabetes, and on and on. Diabetes is the main driver for heart disease, cancer. Diabetes is a strong risk factor for cancer. Alzheimer's disease. Alzheimer's is now referred to as type 3 diabetes because of a strong association with glucose metabolism. So the problem is just treating diabetes with pills, whether it's metformin early on or insulin later on, overlooks the fact that's been known for 100 years, but it's been pushed to the background, is that diabetes is a disease of carbohydrate toxicity. And if carbohydrates are one of the 3 macronutrients that we eat, as your audience may know, proteins and fats are 2 macronutrients that are essential for life. If we don't eat them, we die. The third macronutrient are called carbohydrates, and these are non-essential for life. In fact, you don't need carbohydrates at all, and you can be fine. But carbohydrates are the one thing that really drives insulin and drives type 2 diabetes. So if people just refrain from eating carbohydrates, in most, not all, but most cases, they're able to reverse their type 2 diabetes to the point of going off medications and even going off insulin in many cases. And the problem is this message is not being communicated well by the medical profession, or the American Diabetes Association is a national organization, which is really worldwide in its influence because people follow their recommendation. But it's supposed to be the medical sort of organization's mouthpiece for diabetes. But on their website, they recommend diet recipes. They have recipes on their website that have high sugar and seed oils and carbohydrates, and their attitude is, well, you just cover it with insulin. And this is really counterintuitive because the carbohydrates are what makes diabetes worse. But all you have to do is look at who the sponsors are for the American Diabetes Association, and one of them, even prominently displayed on the recipes with all the sugar in them, is DaVita Corporation. DaVita Corporation is one of the largest renal dialysis companies that basically they pay for ads that advocate high sugar diets, and then which, in my opinion, drive type 2 diabetes, and type 2 diabetes is the number one cause of renal dialysis. So this company, arguably could benefit from those type of recipes. So there are all these pernicious financial influences that prevent this message from getting out. There are a lot of other reasons. I think that it's not just the American Diabetes Association. There are other factors, but one of the points of the book and one of the lies we talk about is that diabetes, type 2 diabetes, is best treated with insulin. And I would say, no, it's best treated just by a low-carb diet, and then you don't need insulin and you don't need pills, and your diabetes goes into remission.
Extraordinary how simple it is. It really is. Talking of another lie in the book, it covers the fatty liver lie. Fructose from fruit impacts the body in the same way as alcohol. And this is something that I spoke about with Professor Robert Lustig. And talk to me about non-alcoholic fatty liver disease and why you think it should be renamed to fructose-associated fatty liver disease. Because most people aren't aware of this.
Yeah, I mean, this was a wake-up call for me, because before I wrote this book, I wasn't aware of this either. But non-alcoholic fatty liver disease is actually a new disease. It didn't exist before about 1980. Before that, if you got fatty liver disease, it was usually due to alcoholism. And so It was all alcoholic fatty liver disease. But then beginning in the 1980s, the incidence of this fat accumulating in the liver, which is indicating liver damage, began appearing in many more patients. And the doctors would, talk to the patient. They go, "You have fatty liver. Well, obviously you need to stop drinking alcohol." And the patients would say, "Well, doctor, I don't drink." And they go, "Of course you don't, but you need to stop anyway." And there was this sort of tension there, but very quickly it began appearing in children, and once it appeared in children who obviously were not consuming alcohol, they had to rename it to some other disease, and they called it non-alcoholic fatty liver disease. And just give you an idea of what an impact this is, non-alcoholic fatty liver disease, this disease that didn't exist before 1980, is now the number one cause of liver failure and is already surpassing other causes as the number one cause for liver transplants, very serious conditions. And to this day, there's still arguments among medical specialties in my medical schools and other medical schools talking about non-alcoholic fatty liver disease. The advice is always, well, you can lose weight. We really don't know what causes it, but I think as you referenced Rob Lustig, Professor Lustig, through his work and others, they've shown pretty convincingly that non-alcoholic fatty liver disease is due to a compound that we eat that is ingested processed very much like ethanol. Ethanol is the compound in alcohol. It's a toxin. What organ of our body protects us from toxins? The liver. The liver detoxifies things. So ethanol goes to the liver where it's processed and detoxified. In the process, it causes, if there are high amounts of it, it eventually causes damage to the liver, this fatty liver disease where fat cells are actually put in the liver cells. Well, there's another element that's also a toxin. It's called fructose. Fructose is a type of sugar. Unlike glucose, which is used, the more common type of sugar that most people are aware of, glucose is used by essentially almost every cell of the body. Fructose, on the other hand, is not used by any cells of the body. A tiny bit is processed in the gut, but most of it goes to the liver where it's detoxified. And interestingly, as Dr. Lustig has eloquently pointed out, fructose undergoes the same metabolic or very similar metabolic pathways to detoxification as ethanol does. So what results from fructose? Well, you get fatty liver replacement, similar to ethanol. So the alcoholic fatty liver disease can be mimicked with non-alcohol fructose and get similar effects. And it's not just the fatty liver, but the fructose also drives insulin resistance, which is that type 2 diabetes and Alzheimer's and cancer and heart disease. It drives insulin resistance. It also raises things like urate in the liver and in the body, and urate affects nitric oxide synthetase, which is an enzyme that affects the endothelial glycocalyx, which is a big word, but it's basically the lining of our blood vessels, and is closely associated with hypertension. So who would have thought sugar could cause hypertension? But anyway, the evidence is pretty convincing now, and to the point where Dr. Lustig has even done controlled studies, blinded controlled studies, where he was able to reverse fatty liver disease in a group of children in a matter of weeks, really, just by removing the fructose from their diet and actually substituting it with glucose. So he didn't change the number of calories. It was isocaloric. So it's the same number of calories they ate. They just removed the fructose, and their fatty liver disease actually reversed to the point that you could see the difference on a medical imaging. The liver fat actually decreased so much it was visible. Really remarkable data. But this message isn't getting out, and many people have fatty liver disease. And in fact, like so many of the other chronic diseases, in one study, almost 50% of adults have low-grade fatty liver disease, and the problem is it's not being diagnosed. It shows up on CT scans, but radiologists don't really mention it unless it's very severe. My background is in medical imaging, so I know the way, the way fat in the liver is treated. It's really ignored unless it's very severe. So fatty liver disease is fascinating. We have a whole chapter on the book and on that.
Just one final point on fatty liver disease. People will then ask about fruit then, because fruit is a source of fructose. So does that mean then we need to cut back on fruit intake?
That's a great question, because, one thing about fruit is it's been around, longer than humans have. So, are we saying this, this quintessential ancestral food is somehow harmful? I mean, non-alcoholic fatty liver disease didn't occur till the 1980s. Fruit has been around forever. So it's probably not the fructose it's probably not from fruit. There are other causes that we talk about in the book, that what happened in the 80s. But the other thing to remember about fruit, modern fruit is very different than the fruit our ancestors ate. If you've ever seen pictures of an early ancestral banana, it looks nothing like the bright green, sweet, sugar-filled banana. So modern fruit has been bioengineered to have high sugar content. So, you can eat fruit, but just be aware you're eating a lot of sugar and a lot of fructose when you do it. Our body can handle a small amount of fructose. Fructose is a signal that we're going to hibernate, that we need to store fat. And that's what fructose does, among other things. So small amounts of fructose can be healthy, but it's actually quite a small amount, because today fructose is not just present in fruit, it's present in virtually every junk food we eat. And most of the food today is junk food. And this high fructose corn syrup, which is subsidized by the federal government, so it's artificially inexpensive and very cheap, has found its way into everything from, spaghetti sauce, of course, to sodas and bread. And, almost any junk food that you see on the shelf has high fructose corn syrup in it, which is 50% glucose and 50% fructose.
You mentioned hypertension already. Can we talk about another lie in the book which you cover? And this is in relation to high blood pressure, in that the lie that we're told is that blood pressure can only be treated through long-term drug use, and you believe that is not the case.
There are studies that we reference in the book that pretty much document this. And to be clear, I'm a physician. I'm not advocating anyone stop their medicines, whether it's insulin or blood pressure medicines, or really any medicine, without doing this in consultation with your healthcare provider. But what I'm saying is, through choices that many people aren't aware of that we can make in our lifestyle, it is possible to change our health so that we may not need these medicines like we did before, or maybe not need them at all. And we talked about diabetes. Well, the same is true with hypertension. There are great medicines for hypertension, and make no mistake about it, hypertension is deadly. It's a silent killer. It has very few symptoms till later. And medicines acutely will protect us from high blood pressure, which damages us. But long term, just like so many of the other pills and surgery for these chronic diseases, the underlying root cause of the hypertension continues to progress. And although the blood pressure is under control, the damage to the blood vessels may continue on. So what I did, I had hypertension, and I went through some changes in my lifestyle, and I was able to reverse my hypertension to the point that I no longer needed these medicines. And I went through with my doctors a process of deprescribing, where, we stopped these prescription medicines, and I was able to control them by addressing root causes in lifestyle that really the book is all the book's about.
Another lie which has been perpetuated is the relationship between heart disease and dietary saturated fat. Can we talk about fat being bad or not? Can we talk about cholesterol and specifically LDL cholesterol? Because the narrative on that is that it has been bad. Your thoughts?
Yeah. Well, first of all, cholesterol, when I was growing up, my mom was a dietitian. So I was immersed in health dietary recommendations, the food pyramid, all this stuff. And at the time, it was believed that eggs, because of their high cholesterol content, particularly in the yolk, should be avoided. And we ate egg white omelets, and we limited the number of eggs we ate just because of that. Well, today, it's now been recognized, even by the most conservative elements of the medical establishment, that dietary cholesterol does not affect blood cholesterol. So you can eat as many eggs as you want, in my opinion. In fact, I consider eggs to be one of the healthiest things that I can eat. It's almost like a hard-boiled egg is nature's Ozempic. If you eat 3 of those a day, you're probably not going to need Ozempic because your appetite's going to go down. Eggs are high in. They contain fat and protein. They contain very little of the bad carbohydrates that we talked about. So they're almost a perfect food. So eggs now could be eaten, but interestingly, many people and even many of my colleagues are still not aware of this. They still, say, "Oh, well, avoid eggs for your heart," and that's just not true. Now, as far as that's dietary cholesterol. Now, as far as serum cholesterol, LDL has been a target has been a target of managing heart disease because why? Because we have a pill that makes LDL go down, that lowers the LDL. And that's, of course, the large class of drugs that we talk about called statins that are one of the best-selling drugs of all time. And they're prescribed ubiquitously. And as we get into the book, we sort of peel back the layers on statins and LDL cholesterol. And that is statins, have an improvement in heart disease, in decreasing heart attacks. And hey, if heart disease is the number one killer, I'll take anything. But it's a small effect. It's only 1%, but I'll take 1% even. The problem is the benefits are exaggerated. Many advertisements and physicians believe it's about 30%. So the benefits are actually much lower. There's 1%, but still 1% is good. So the downside of statins is there are a lot of side effects, and these include leg pain, brain fog, depression, suicidal ideation, to the point where if you look at patients who take statins in some recent large studies, the people who take statins have fewer heart attacks. So they have fewer deaths from heart disease, which is great. Again, I'll take that. The problem is a disturbing factor is when they analyze what's called all-cause mortality. In other words, patients who had statins, their all-cause mortality didn't change. In other words, overall, they died at the same rate as other people. That meant that something else went up, right? They had fewer heart attacks, but they had more suicides. They had more traffic accidents. They had, which doesn't make sense other than the fact possibly lowering LDL cholesterol has effects like on the brain. Our brain is made up of cholesterol is one of the major components. So when we lower the cholesterol, there are, some of the side effects there. So there's a lot we don't know about that. But yeah, LDL cholesterol, people have pointed out that most people who come in for a heart attack have normal LDL cholesterol. So it doesn't appear to be the strong risk factor that we used to think it was. Even though we have a pill that will take care of it, it's not, as far as what we call hazard ratios or risk contributing to the disease, LDL cholesterol is very low. What does contribute to heart disease and my risk of dying of a heart attack? Well, things like HDL cholesterol, which is the good kind of cholesterol. I want that to be as high as possible. Triglycerides, I want those to be low. And HDL cholesterol and triglycerides are associated with metabolic disease, which are affected by our our lifestyle and our diets and insulin resistance. Insulin resistance is a much bigger risk factor for heart disease than LDL cholesterol. What does that mean? I'm much more likely to increase my risk of heart disease by eating a donut than by eating a steak. Something high in carbohydrates is going to be worse for my heart than something high in fat and protein like a steak or a hard-boiled egg. And this message, I think, is still not reaching people. As you say, people still fear saturated fats, LDL cholesterol, and these things in our diet. When I think I believe, and we show evidence in the book, that the real dangers are things that disrupt our metabolism related to carbohydrates and metabolic disease.
There is so much value in this book. It covers other lies, including the longevity lie, the mental health lie, the Alzheimer's lie, the cancer lie, which spoke to me because I had a conversation with Professor Thomas Seyfried not long ago, and he spoke about the cancer being ostensibly a disease of metabolic dysfunction rather than of genetic inheritance. So that really spoke to me. But if people want to find out more about your book and about you, Doctor, let me give the title of the book again. The book is called Lies I've Taught in Medical School. Tell us where people can find you online, because I know you're very prevalent on social media, including on YouTube.
Yeah, I just got a preprint copy of the book. This is what it looks like. If you want to check out the book, you can come to my my website and download a free chapter to see if you like the writing style there. The website is robertlufkinmd.com. And also, yeah, I'm active on social media. Please follow me there. You'll see all the links on the website as well.
Great stuff. And I'll pop a link to all of those websites and to the book as well in the show notes for this episode. Dr. Robert Lufkin, congratulations again on the book. Really enjoyed reading it, and the best of luck with the sales. I believe it goes on sale from the 4th of June as well.
That's correct. Yeah, and hello to everyone in Ireland and your worldwide audience. I realize you people all over listening to this. I'm really a fan of your program, and this has been a joy to talk with you today, Matthew.
Well, thank you for tuning into this episode of the Happy Habit podcast. If you got any value from it, or indeed any of the previous episodes, there are over 400 now. Show your support, like, subscribe, tell other people about this podcast who you think might get value and education from it too. You can also check us out on YouTube, become a subscriber there, join the conversation by adding your own comment or thoughts, and click that bell notification for future videos that come every Monday and Thursday. Until next time, stay happy.